Today I want to do a short video about NSAIDs and how they may or may not be a risk when you have COVID. So NSAID stands for non-steroidal anti-inflammatory drug. It's a common painkiller class of drugs. The most common one that you've probably heard of is Ibuprofen, or the most common brand name for that is Advil. So NSAIDs, like ibuprofen, are different than drugs like acetaminophen or Tylenol because on top of working directly on pain, they also impact inflammation or swelling. So that means that there's two different mechanisms that they use to work instead of just the one like acetaminophen or Tylenol. So they're very effective for things like arthritis, for example, where there might be some swelling in the joint, but also the pain. The reason we bring this up is because there's been some reports in the media that it's dangerous to take NSAIDs like ibuprofen when you have COVID. This comes from a few anecdotal or individual stories and one case control study. So for those of you out there that know about case control studies, you'll know that it's not one of our stronger study methods as far as being able to determine if there's truly a causation link. So did the one thing really cause the other? It's a cheaper and faster way to get results, which in the world of COVID, we need fast results. But it makes it really hard to know if truly the outcome is due to the thing that we're studying. So there did seem to be some worse outcomes in people who took NSAIDs compared to acetaminophen when they had COVID. That's really the only study we have to go on right now, apart from some individual case reports. So the conclusion that most people have then is if you have COVID, for controlling the symptoms like pain and fever, start with acetaminophen and only use ibuprofen or other NSAIDs as a backup or as a secondary option. But if you're already using NSAIDs for some health condition in your life, like if you have arthritis, for example, we don't have enough evidence to say you should stop. If your pain is being well managed by your NSAID, stopping it is probably going to cause you more grief than the potential benefit of avoiding what we don't even know for sure is causing some bad outcomes with COVID. So the summary is, NSAIDs might be more problematic in COVID, so don't use them as a first line for treatment of COVID-related symptoms. But if you're already using them, you also don't need to stop just because you now have an infection.